Morning crew there. Well, staying with health, and every 12 minutes, someone in the UK is diagnosed with bowel cancer. Screening is offered to women and men aged 50 to 74 across Scotland. But an Aberdeen woman says that age bracket needs to be lowered after she was diagnosed with the disease. Here's Reem Sattar.
For 6 months, Kay was experiencing extreme fatigue and losing weight. After getting blood tests almost every week at her GP, she was diagnosed with stage 3 bowel cancer in 2023. At just 41 years old, she was under the screening age for the disease, which prevented an early diagnosis.
It was never brought up that it could have been anything potentially cancer or anything like that. They just put it down to me being kind of run down or going through menopause at my age. You know, we had to push to get these tests, and it took for me to pass out to get to my diagnosis, to be fair, so it was quite hard going.
A survey conducted for Bowel Cancer Awareness Month revealed a third of people are unable to identify the symptoms. Kay believes there needs to be better communication around the disease.
It's so common now for people under the age of 50 to be diagnosed with bowel cancer now. I think just more communication, letting you know what is actually going on, and listening to, the patient, and thinking, oh, you're too young for that. That's not going to happen to you, and it did happen.
Bowel cancer is the 4th most common in Scotland. Screening is currently offered to those between 50 and 74. However, Kay is calling for this age to be lowered. NHS Grampian is looking to increase testing, especially for those from more deprived areas.
Screening is for people without symptoms. So what we would say is that anyone experiencing symptoms, which can be things like having blood in their stool, a change in bowel habits lasting more than 4 weeks, if you're losing weight without trying, or if you have severe abdominal pain, particularly after eating, we would say that please speak to your GP in that instance.
People generally think that bowel cancer only happens to people that are over 50. We need to push on this, and the screening level should be taken down, even to 30, to get the screening done.
It's hoped an increase in testing will mean sufferers can be diagnosed earlier. The NHS is currently trialling a blood test, which could catch the cancer at an earlier stage. Reem Sattar, STV News.